quite a bit of variability between, how people are treating and the treatment techniques, which is totally fine. Right, so I understand with acupuncture, there's a lot of different types of things that you could do. There's such a big scope of practice. Uh, so I kind of just wanted to kind of get an idea of how things are coming along within your guys' practice and what we can do to improve that, and some of the stuff that I can educate you on because I've had sessions with a lot of the acupuncturists here. So basically, when it comes to acupuncture and how it integrates into pain-free health rehabilitation, these are some of the things that I kind of pulled up online, and what are your guys' thoughts as to how acupuncture complements the whole aspect of rehabilitation? Could anyone kind of tell me, what do you guys tell your patients? Let's say someone asks, is like, what's what does acupuncture do? Because I'm sure you guys get that quite a bit.
So depends on patient, like what they came for. If it's ICBC or more, let's say muscle related, usually we are first who can help them with the pain management and then help them with to so low pain and also help with circulation and faster healing, because if you when you put needles into certain points, they can also help to heal faster from a first, like from initial injury. And then after a certain time they add kinesiology, and that's why we are first who they cut. How I understood. But mostly to help them to heal faster and pain management. And also, speaking of, for example, ICBC, I personally work a lot with anxiety and sleeping disorders, because none of other practitioner can work with that in the clinic. So that's the main things.
Okay.
And some of them, they come for continue coming for digestive issue, for more emotional support. So these I don't know, menstrual issues. So at that point we are only practitioner who can help, but mostly with removing that, let's say, blood stagnation or warming up area with moxibustion, things like that.
You can come in if you want. I didn't know you were out there. Yeah, you can come in. Angel's just here, so maybe you can quit your presentation there. So yeah, that's good. But to a layperson, like blood stagnation, this like it just it can be quite confusing. So that's why from I'm not an acupuncturist by any means, but one thing I'm good at is I feel like I'm good at is explaining to people what the point of certain therapies is as much as I can. So what you guys have to do is when you are explaining your therapies and the treatment plan, you have to simplify it. And once again, what you have to do is you have to also figure out what type of a patient is in front of you. Whether it's a patient that believes in energy, whether it's a patient that doesn't believe in that stuff, whether it's a patient that doesn't believe in acupuncture. It's like, what do you believe? What would you do with someone that doesn't necessarily believe in acupuncture? Right? So that those are kind of the things that you have to look at. And certain clinicians here, you can, if you want to sit down, you can come over here. You don't have to stand far. So basically, what you got to do is figure out what type of patient you're dealing with, and then go from there. Right. So and then also another big thing, and one of the reasons, like I say, I've had acupuncture with different people within pain free health and outside of pain free health, and the thing is, you guys, there's such a big scope that you guys present. You could do cupping, you can do acupuncture, you could do gua sha, you could do shockwave, you could do whatever the hell you can. in order to figure out what suits best for that patient, right? It just being that acupuncturist that's going to stick people, with needles in their, in their scalp or their, in their hand or their feet. It's like that time is come and gone. So what you got to do is you have to look to evolve. You have to look utilizing different skills and different tools. Like like what Susie does in with her gua sha. I mean, it's such a great experience that I don't understand why everyone else wouldn't be doing that, right? So it's not necessarily what you got to take yourself out is. It's not what you believe in, because for example, I know Maria believes in one thing, Angel is a totally different thing, Susie's a different thing. But what you have to do is you have to figure out what the patient believes in and kind of cater to that. When I have a patient that always talks about energy, this, that, it's like, well, I'm going to treat them differently than an athlete that comes in. So you have to always think and figure out, and that's where that initial assessment is so important. Those 45 minutes or an hour that you have is key to figuring out what type of patient you're dealing with. So it's so important. But utilizing, because all of these tools like gua sha, especially, when Susie puts it that, has that heat and then has that heated rock, I think that's called gua sha. And I mean, it just feels so darn good. Like, why the hell wouldn't I come back to it? So you guys have to create those experiences so that people like, hey man, I felt so good after that treatment, because what they perceive the most is right after they get out of that acupuncture session or physiotherapy sessions, how do they feel? Like the next hour, because that's what they're going to remember. And then when they have pain, what's going to happen right away, they're going to be triggered. Hey, I want that good feeling again. Well, I'm going to go back and get acupuncture or what have you. That's what you have to try and create. And once again, it's not about what necessarily what you think is the best thing. It's also thinking about taking into consideration what the patient believes in. If they don't believe in acupuncture, I have a bunch of patients, they don't like dry needling IMS. They're like, hey, I get a lot of fear. I'm not going to push that on them at all, because I have different tools that I can utilize in order to make sure to get that patient better regardless without that. And then after I gain that trust from that patient, then I'm going to be like, okay, well, let's try one needle. And then you kind of start with that. But that's kind of what you have to do, rather than right away going with that initial assessment out of the gates and doing what you believe is the right thing for that patient. That is one of the biggest things when it comes to caseload management, and just making, figuring out what the patient wants and then going from there, and then slowly interjecting what you think is the right thing. So you also have to ask yourself, what does your typical session look like? Why is this so important, Angel?
Oh.
What your typical session looks like?
Typical session?
Yeah, I'm going to start with Angel and I can go to you guys. What does your typical session look like?
Typical session, usually I'll...
You can be a little bit louder because they're...
Oh,
yeah.
so usually I'll do cupping first, and then acupuncture. Also depends on their symptoms. I will do gua sha.
Good.
To after finish the treatment, or sometimes it's massage, like tuina, acupressure.
Good.
Yeah.
Yeah. So acupressure, but do you always do the same format or do you change it?
I do change it.
Okay.
Because it depends on the area and symptoms.
Maria, what does your typical session look like?
Give me a second. I can press the button. Basically the same. I usually start with cupping, and then do needles. Sometimes depends on person and level of pain. I do more towards dry needling. Sometimes more electrostimulation. Then I do gua sha. But if I have somebody who is really sensitive, I do more massage. And that's it.
Yeah, so that hands-on part is very important.
And then I do some stretching, and then I crack their back.
There you
if
go.
I do back. If I don't,
yeah, so adding a little bit of pressure. Yeah, so that hands-on component is so important. So, and you know, when the patient's there, trying to spend that time with the patient. But once again, it really depends what kind of an energy they came in with. If they're very stressed out, and you know, because I've come to Angel and you know, she's put the needles in and kind of left me for 10 minutes, that's really helped. But it really depends on what type of, so you got to figure out and gauge what type of a, you know, state that person's in, because not every person's going to respond the same way to every, you know, and same thing with that person might not respond to the same session throughout the treatment protocol. So that's where you have to look at what, you know, you have to try and figure out what works for you, because the reason why the session flow is so important is because what you are, once again, you're creating an experience for that patient. You know, maybe, you know, what I like to do typically with my physiotherapy sessions is I like to feel out the tissues first. So what I like to do is I like to do my hands-on work first, and then in that way I figure out which areas are the problem spots. Like, hey, you know, this one's not good, this one's not good, this one's referring into the arm, this, and then from there what I do is I kind of specify and go into that area a little bit more, and dedicate more time to that area, because there's nothing worse than a patient coming in with right shoulder pain and a physio spending, you know, 75% of their session working on the left hip. The patient is like, what the hell just happened? So that's why what I suggest you do is first little bit of the session, feel out and see. Obviously get a nice little quick subjective, figure out where the pain is, and then kind of feel the spots. And you know, this takes a little bit of practice, but trying to just feel the areas rather than just aimlessly massaging or pressing or whatever, feeling the areas that are the trouble areas. And you guys know all the trigger points, you guys know how all that works. And then from there, utilizing your tools, whatever, like cupping, electro, acupuncture, gua sha, and all of that stuff to tackle that area. Because I find often when patients come in, you know, what you got to do is you got to present yourself as a professional and someone that can help with their pain. Now, it doesn't mean that their pain is the whole body, but rather, you know, a lot of times they come in, I got right shoulder pain, I got neck pain. And then, you know, you kind of want to focus in on that rather than, you know, putting needles in their left ankle. Because all of that's the time just takes time away from actually treating the patient. So when they're there, you're kind of 100% invested into them and trying to get them better in that whatever time you have, 30 minutes, 45-minute period. So that's kind of what you have to look like. You have to make sure your flow is, and every patient has a different type of flow. And most of my patients, when they come out with something. You know, I put tape on them. I do whatever, things that they can go home and be like, oh man, that really helped. I remember that physio session, that taping really helped. You don't understand how many people come back just because of the taping. So utilizing things like this, these little patches. I mean, this thing is, I mean, it's not, let's see if I can, how do I, there you go, stop presenting. Like this thing, man. Getting one of these guys, these, you know, at the end of the session, slapping on a pack. So many people come to me like, hey, I put on Salon Pass last night and it helped. Well, why the hell aren't we doing this? Put this thing on. Use this cream. At the end of the session, utilize the cream. Put it on, especially the areas that you kind of went a little bit harder. Because when that patient gets out of the session, how they feel is so important. That's the key. So utilizing these little tricks and tools to make sure that you get the best experience we possibly can. Let me just check and see. Can you guys see the presentation?
Yes.
Okay, perfect.
My microphone doesn't work.
So basically, very important looking at what your typical session looks like. Understanding that your patient and that you and your patient do not, they don't think like you. They have their own way of thinking about things, so therefore you have to embrace that. Like I say, rather than just going on one hard line, I'm going to do this and that's right for you. So many people come to me because that's what their past physios have done. They've just done the usual, exercise. They haven't actually listened to the person. I had a lady come in yesterday from a hand. She had some hand thing, and she went to a hand therapist. She went to a physio, therapist. She even went to a specialist. And guess what her specialist said? You have tendonitis in your forearm. And what did the physio do? The physio freaking kept giving her exercises rather than getting in there and working on, trying to reduce the tendonitis, the inflammation. Because that's all they do. It's like you have to listen. So that's why at the initial assessment, I always ask, what did the previous therapist do? What works for you? What doesn't work for you? Rather than just slamming a patient on the bed, take 10 minutes to actually, 10, 15 minutes to get a good history out of the patient. What has worked before? What's causing the issue? Is there night pain? And then during this time, you set your baselines. I get a patient coming in. I have night pain because of this pain that I'm having. Well, one of my baseline number one goals is to reduce that pain. So you have to have some sort of a goal to kind of aim towards, and for this patient to be like, okay, well, this has gotten better. Because when that night pain goes away, guess what? The patient's not going to realize that. But then if you keep asking, do you still have night pain? Oh, it's like the night pain's gone now. Well, this therapy is working because you had night pain when you first came in. Oh, okay, yeah, I remember that. But they're not going to actually remember because they're so busy with other things. So take the time with that initial assessment to really understand the patient, figure out what their goals are, and figure out why the hell they're coming in to see you. Because even that ICBC patient has some sort of they got some sort of an issue that you as a clinician have to work out. And every single session, you have to ask, how are things coming along? What are the issues? What do you think we need to work on today? What's causing that? Is it work? Is it this? Is it that? And then you make suggestions based on that. And also setting these SMART goals. Are you familiar with SMART goals, Angel?
Yeah.
So just like in exercises, you yourself have to be able to set SMART goals with your patients in order to make sure that there's patient recovery, especially with ICBC patients. Specific functional things. Doing this, better energy. No one cares about better energy. No insurer is going to approve you based on this person has better energy now. No one's going to approve you if they say, oh, there's less blood stagnation now. We have less of that. Less pain. No one cares. So what you have to do during especially the initial assessment is set those things. If an ICBC patient's coming in to see you, hasn't started working, why, what's going on? What kind of things are you struggling with to get back to work? Is it lifting with your right arm? Well, as an acupuncturist, I'm going to focus on that right arm range. I'm going to make sure that the muscles around that right shoulder are functioning well. So these are little things that you, at the initial assessment, setting those SMART goals. But once again, in order for that initial assessment to work, you have to chart. Because I have so many clinicians here, they're not charting. That initial assessment, very important to get the chart, especially the initial assessment charting. Take 15-20 minutes and figure out what your patient wants, what your patient needs, set those baselines, and then try and, especially that subjective part, try and copy and paste that into your future notes and then see whether that's getting better or not. But the key is charting that first session in the first place, because if you're not charting that first session, you're not going to even remember what the hell you did or what the baseline is, and then that kind of defeats the purpose of the whole rehabilitation, especially with insurers. And you guys can also go as far as doing, are you guys familiar with disability forms? Like upper extremity disability, lower extremity disability, low back disability forms. Those
I'm not familiar with
so
that.
I'm going to share that in the family group because those are all things that you can get patient to fill out, and then you can basically use that for your insurer, for them to send to the insurer, be like, hey, this is the current thing. We're gonna and then this way that can also help you with your form filling as well with insurers. So the measurements, initial assessments, key, figuring out what kind of measurements you have in within, and even as an acupuncturist, there's no shame in doing strength testing. Do you guys do strength testing and range of motion at your initial assessment, or no? Do you guys just slam the patient on the bed? Okay, so
That's not part of school, but maybe, I mean, we can do it, but we didn't study that.
that's the
Many
thing.
things what we are doing right now, we didn't study. Even for ICBC, when I supposed to do my first chart, I didn't know what's going on.
You probably talked
Because
about better
nobody-
energy, right? Better energy.
Yes. So there is no lifting or anything or driving.
But these functional
So-
things are so important, even in a non-ICBC client. Measuring the
that's
strength of that
fair,
shoulder
yeah.
or the hip, because in that way you can tell that patient, hey, before you started this therapy, you were here this strength, or you weren't able to bring. And all it is, it's not very complicated. And we can have this in person where I show you guys. It's like you just move the person around, shoulders back, little reach tests, and then little strength tests of it takes 3 minutes to do. And then you add that under your objective. But range of motion is very important, especially in a rehabilitation setting, because this is a rehabilitation clinic. So adding the range of motion, and basically this is all I get the patient to do. I get them to reach up, do a little scratch test, and see how their range of motion is there, and that's it. And then same thing for the hip. I kind of twirl the hip around a little bit, do a little movement of the hip, and then I look at that, and then I get them to come down, up, quick rotation, and then I note what I do is in charting is I note any limitations. I don't necessarily note like the good stuff because it's all within normal limits. But what I do is I just chart that, and then what I do strength testing wise. So come here, Angel. So imagine I'm the patient. All I do is I tell the patient if it's a shoulder problem, can you hold and then what you do is you just press. That's it. Press, 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 press. And I start with the better side, and then I go to the worst side. And then you note the differences. Yeah. And what I do is I note a normal is 5 out of 5, good strength. And then, 3 out of 5 is they can hold it, but not really when you press down. 2 out of 5 is they can't even hold it there because of the pain. So you kind of then these tests are mostly based on not necessarily what the overall population is, but what their good side is doing compared to the affected side. And like I say, we can also have an in-person. Yeah.
Is there anything that needs to go to Ladner?
I don't know. You tell me.
I don't have anything. I wanted to make sure with you.
No.
All right.
I haven't been to Ladner in 2 weeks. Present no. Okay. Okay, good. So that's that. Are you guys able to see the presentation?
Not for now. Now we can.
Good?
Yes.
Perfect. So take some time to set the parameters for initial assessment, and it should be functional. Another big thing is sleep. I always ask about sleep and work. What kind of things at work are bothering the patient because everyone has to go to work and do the work. And then from there, understanding how to progress the patient and also turn them into lifelong patients. Because I feel one of the biggest disservices you can do to a patient is see them twice and then not see them again. You don't have to see them once a week. You don't have to see them once, even every 2 weeks. Is like, I get people to come in once a month even. Come in because every time when they come in, you kind of get an idea of what's going on with that patient. Even after a month, what are the weak links and what are the areas that you kind of need to work on and get in there. That's one thing I think the reason why Susie's very successful at getting and having having the highest patient retention is because of the fact, she really educates people and she's very sincere, and I feel like she believes that people need to be coming in to see her. She's fully convinced that if people don't come and see her, their quality of life is not going to be the same. Whereas someone like Maria, she needs to work on that because Maria is often, hey, you can come this time, you can come this time. So what we got to do is you have to be very direct. And same thing with you, Angel. You have to be very direct. And Susie, that's one thing. She's like, you need to come in this time, this many times, and this time. Whether that's the right thing or wrong thing, who the hell knows? But Susie's convinced that that's what it is. So that's where yourself, you have to be very forceful and you have to be convincing and sincere because, like I say, Susie sincerely believes that she is helping people. And I mean, you ask her patients, she is because... And then another thing, when you come and see Susie, she gets to work right away. She's not messing around. She gets in there, gets her job done, and focuses on the area that's the problem right away. It's like, here's the thing. And Maria's getting a lot better at that as well. Because I feel like schooling hasn't geared you guys towards how real life is and also how these rehabilitation clinics work versus traditional Chinese way of doing things. It's a little bit different. And also you're dealing with a certain population that doesn't necessarily understand acupuncture either. So you have to add that hands-on rehabilitation aspect where people kind of feel better afterwards. That's kind of just what we're dealing with. And then also, are you educating the patients? So education's a big thing. Talking to them about the benefits of acupuncture, what kind of things, it doesn't even necessarily have to be acupuncture. It could be other things that you've learned, that you've kind of studied. And that's where, even doing little blogs and doing different things that pertain to acupuncture and that, you guys can send to us that we can put on our social media. Because I haven't had anyone, other than Maria really reach out and be like, okay, here, this is the benefits of acupuncture during pregnancy. I can tell you that most people are shit scared of getting acupuncture during pregnancy because that's what they've been told by everyone in the healthcare system. So doing little blogs like that, little things that can engage patients. And I can see a lot of times with your guys' schedule, there's some space in between patients. Like, what are you doing in that time? Are you on your social media? Are you promoting other people? Are you sharing all these random videos with your friends? And rather than getting yourself better, you're kind of helping other people get better at what they do, which is fine. But in that time, utilize that time to send us blogs. I understand most people aren't comfortable with video stuff. Send us blogs. Like, for example, Angel, if you got a massive break today, go on ChatGPT. Be like, hey, how is acupuncture help people with postpartum people? Women postpartum. How does it help? It'll tell you the thing. You take some bits and pieces. You kind of piece it out. You send it off to us. Be like, hey guys, I want this blog up on the website. Simple as that. Little things like that in your time off, what can you do to kind of better yourself so then you're able to educate your patient rather than mindlessly scrolling through media. And these are the things that myself at Pain Free I look at. These are key performance indicators for myself. Because of the fact we have 60, 70 contractors under Pain Free Health as well as the mobile clinic, I cannot go and get feedback from each patient as to how Angel's doing, how Maria's doing. But I can pull up a quarterly report as to how many visits that patient that comes in to see your acupuncturist, how many visits are they getting on average before they get discharged? Self-discharged or get discharged. So at Pain Free Health, we have anywhere from 3.8 to 5.8. And that 2 number, it's like you guys might not think it's a big deal, but imagine 2 patients added onto your schedule. That every single patient that you have is being seen 2 more times than 3.8 versus 5.8. That's a huge difference in the amount of people you're going to be able to see in your schedule. And this directly correlates as to, because there's no reason why someone like Susie should get more than everyone else. Because Susie's a human. I mean, she is Korean. That's a little bit different, right? So, but what I'm saying, there's no reason why someone like Susie should get 5.8 versus someone else should get 3.8. It doesn't. So then, what you got to do, even yourself, rather than being hard on yourself, is like, hey, I'm not good at it. Figuring out what else you can do to better yourself and to improve your ability to get to that patient that comes in and get to that stage where even 5.8. I feel like 5.8. We can even get up to, because I have some physiotherapists, they're at 12. Right? But funding is a little bit different for physiotherapists versus acupuncturists, so I understand that. So if we can even, my goal is to try to get everyone to get 6, 7, 8. Because one of the things I hate the most is when there's gaps in the darn schedule. But that's something, yes, Pain Free Health needs to work on, but also it's on you as well as as the clinician, as a contractor, to be like, hey, what's going on here? Am I getting enough initial assessments? Okay, so that's been ticked off. I'm getting some, but I'm not. I wish I can get more. Okay, that's one thing. But also the people that I've seen, how can I make sure that they're coming back? Whether it's working hard on the drop-off list, whether it's going to the front desk and being like, hey guys, I need that list, so then I can personally go and email these patients to see how they're doing, the ones that have dropped off. These are little things that in that 2-hour gap that you have, rather than going on social media and just being mindless throughout the day, you can take that time to optimize your schedule as well. We look at patient retention and also hours scheduled versus how much you booked. And also we look at the initials with each clinician. So hopefully by the end of this presentation, I've kind of given you guys some ideas as to what kind of things I'm looking at as us as at Pain Free Health, what we're looking at. And also, my goal is to make sure that you guys are, there's nothing better for me than looking at Maria's schedule and she's fully booked. It's like awesome. That's kind of what we want. And I know for a fact that's what she wants, and everyone wants that. But in order to get to that level, there's certain things that you have to be accountable for, and you have to look and be like, hey, what can I do on my end to get to this level and to make sure, because there's no reason, like I say, even myself, why I should have a full schedule versus someone else that doesn't have a full schedule. We're all humans, we're all capable of doing different things, but it's what I do within that session when I'm with the patient, as well as what I'm doing afterwards, because you guys can see on some of those chats, it's like, I have an empty slot, I'm going to fill that slot. And I'm going to do whatever the hell it takes to get that slot filled. But if you're not hungry to get that done, then, other people aren't, because there's multiple contractors within the clinic. So you have to prioritize, and you got to show to the front desk that you're hungry and you want to make sure those patients are booked. And I feel like Susie does a great job at that. She's very, if there's a slot that's not booked, or if her schedule is a little bit spotty, guess what's going to happen? Susie will text me like, hey, my schedule's not looking good. What can we do about that? And what that does is that right away, that sends a cascade of texts to Kat, all the other front desks, be like, hey man, what's going on with Susie's schedule? So you guys need to be proactive and have to be like, hey guys, like even setting meetings up. For example, in South Surrey, your Parm's the one in charge. Angel will be like, hey man, my schedule's not that busy. I want to make sure that, you know, what can the clinic do for me? Here are the things that I'm doing. Here are the things that I've been doing for the last 3 months. What can you guys do for me because I'm still not busy enough? Versus just, you know, having 2 patients and then having a 2 hour gap and then having 2 patients again. I mean, I don't know how that's palpable for anyone. I mean, for me, it wouldn't be acceptable. But first thing is, you guys have to do stuff on your end as well. Those are the most important things. Does anyone have any other questions? So to summarize the meeting, figure out what your patient also wants. It's important. Each of us have had different experiences. Each of us had different training. Figure out what that patient wants. Cater a little bit to that patient. Figure out what that's why that initial assessment is so important. Figure out the baseline. Why is the patient here? Why in the hell are they here versus spending time with their kids? There's some sort of pain that's happening. They didn't come there just for shits and giggles, right? So figure out, what the pain point is and how you can improve that so that patient's going to get better and then tell their friends about the experience they've had with you. And then throughout the session, create an experience. Utilize different tools. Utilize different skills. And, for example, with Angel, she did all that stuff and then she left me for 10 minutes to kind of just relax. I hope she doesn't do that with every single patient, because she needs to understand that certain patients need that. And then others, they want more of the hands-on stuff. So you got to figure out, and what I do a lot of the time is after when they come in for a second session, I ask, how was the last session? What worked? What didn't work? What made it worse? That's another great thing to do. And then throughout the session, create an experience, even for after session, utilizing these things. We can work out on getting these within the clinic as long as you guys will use them. And I use tape. It's great. People love the tape. I might even get into using this stuff too, because it's great. And sometimes people have adverse reaction to tape. No biggie, man. They got a bit of a burn, whatever. It happens. I won't use it again. But same thing with this. There could be some adverse effects, but who the hell cares? People move on. As long as you tell people, hey, if there's any itching, if there's anything, take it off. That type of thing. Same thing with this. Utilize that. Create that experience. And then what you also have to do as a clinician, you have to create that roadmap for that patient. What the hell is the goal? What are we aiming for? And one of the things that I like to use as a physiotherapist is the PhysiTrack app. Is I set up a exercise program for that patient day one. I send them some exercise, whatever the hell it is, neck stretching. And then I tell them, based on as we gradually progress and get stronger, I'm going to add more exercise. And I show them how the app looks like, and people are amazed. And then that way, that patient with that app, together with that app, they're connected. So then I can progress them and then justify as to why the hell that person needs to come in once a month. And then when you have time off, trying to figure out how you can do to better your schedule, what you can do to bring people back in, and also educate. Because once you're educating and you're reading enough stuff and you're playing with ChatGPT, because ChatGPT knows a lot more than we individually do. Just researching things, creating blogs, sending it to us, we can post it, we can put it on our social media. Those are the things in the long run that will educate you and that will propel you to be good at what you do. So those are the main things. So that's kind of the summary of the meeting. You guys have any questions?
No questions, but we could do this a little bit more often because nobody teach us these things in school. Personally, I do tape on people because I did that in my physio school. So
yeah, tape is
but
great.
People who don't have experience with physio or any kind of Western kind of medicine, we need meetings like this, because what we study in school is put needles, leave patient for 20 minutes, come back once, retain the needles, leave, and that's it. So that's how I started a year ago. So then I realized it doesn't work on that way.
No, it does, that doesn't work that way. And you know the beauty of it is the way I see it is one of those things. Even as a physiotherapist, is I'm always in competition with other physiotherapists. So I always have to have the better things that I do, and that's what I feel like makes me good. Is I'm very competitive in a sense that you know patient comes to me, it's like, oh, the other physio just did exercises and tens unit. Well, it's like, man, I'm gonna wow your world. I'm gonna do this, do this, do this, and then after 3 sessions, they're gonna get better and send other people to see me. So same thing. The default in the acupuncture world is what Maria just said. But what you have to do as a clinician, you have to go to the extra mile. And that's one thing I see Susie doing a lot, and even Maria's doing a lot more as well, is that aspect. And I can't speak for Steve or Lily because I haven't really seen. Angel does great work as well, and I've had good response. But you guys always have to evolve and do different things. It doesn't just have to be one thing. And like Maria says, after someone comes in with shoulder pain, well, put a couple of pieces of tape on. And I will be having a taping course in April, so you guys better tune in and kind of look and see, what's going on and learn that part, because that taping part's very important. But same thing with this. This part here, someone coming in with low back pain, at the end of the session, slapping a couple of these guys on makes a world of difference. So important. But anyways, I gotta jet out. I got a doctor's appointment at 10. But it was great meeting you, and we'll probably set something up. Alicia, if you can set something up in about 3 months, please, and we'll kind of revisit things. Okay, thank you.
Okay, bye guys. Thanks for joining.
Bye, guys.